Hello, everyone, and welcome back to the Psychiatric Mental Health Nurse Practitioner Exam Prep. And we are going to talk about non-pharmacological treatments of psychiatric disorders. So first, we have individual therapy, and there are a few different types of therapies that we need to know. So the first one is the psychoanalytic therapy, originated by Sigmund Freud, believed that behavior is determined by unconscious motivations and instinctual drive, and promotes change by the development of greater insight and awareness of maladaptive defenses, attends to past development and psychodynamic factors which shape present behavior. We then have cognitive therapy. This is by Aaron Beck, who believed that external events do not cause anxiety or maladaptive responses. He states that a person's expectations, perceptions, and interpretations of events cause anxiety, and it allows clients to view reality more clearly through an examination of their central disordered cognitions. And the goal is to change the client's irrational beliefs, faulty conceptions, and negative cognitive distortions. Behavioral therapy was originated by Arnold Lazarus. It focuses on changing maladaptive behaviors by participating in active behavioral techniques such as exposure, relaxation, problem solving, role-playing, and modeling, such as modeling a positive behavior or how to solve problems. It teaches parents parenting skills, is a behavioral technique. So this could be DBT or CBT, the behavioral component of those. There's then cognitive behavioral therapy, and this aims to change our thought patterns, our consciousness and unconscious beliefs, our attitudes, and ultimately our behavior to help us face difficulties and achieve goals. The therapist and client work together as a team to identify the client's problems, devise strategies for addressing them, and create solutions. Journaling and cognitive restructuring help to reframe beliefs and negative thoughts. This is high yield. And we can see on this slide as well the 9 essential CBT tools. So journaling, which can help with self-reflection and identifying thought patterns. Nightmare exposure and rescripting. So this treats nightmares and develops new responses. Relaxed breathing can support a range of issues and calm and focus the body. Play the script until the end treats fear and anxiety, reflects on worst case scenarios, and improves feelings of coping. Unraveling cognitive distortions helps to identify faulty thinking and challenge that thinking. Progressive muscle relaxation can help to calm and have a mindful focus on physical relaxation. Cognitive restructuring helps to explore causes of faulty thinking and reframe and restructure them. Interoceptive exposure treats panic and anxiety, purposefully exposing to the situation. It instills an understanding that sensations are not dangerous. And exposure and response prevention, purposefully exposing yourself to a trigger and mindfully controlling the response. So in cognitive behavioral therapy, there is kind of a triggering event. And in cognitive behavioral therapy, they believe that our behaviors, thoughts, and emotions are all interconnected. So say there is a triggering event, right? Your emotions, how you feel about that event. Maybe you're frustrated or hopeless and sad. And that is going to affect your behavior and your actions and what you do. Are you going to procrastinate? Are you going to try to avoid or compare yourself to others? And that's going to affect your thoughts. So words that you tell yourself, your internal dialogue, for example, I'm never going to be good enough, which then is going to circle back and affect your emotions and how you feel. Cognitive behavioral therapy focuses on present events and maladaptive responses. It uses many tools to collect data between therapeutic sessions and attempts to capture the client's expectations, perceptions, and interpretations of events. It helps them to view the reality more objectively by examining cognitive distortions and our automatic thinking patterns. The aim is to change the client's irrational belief, cognitive distortions, and dysfunctional thinking patterns. And we went over some of the exercises that can be used to do that. And we talked about how your thoughts affect your behaviors, affect your emotions. So cognitive behavioral therapy is evidence-based to treat all of these conditions. There's a lot. It is great for many different things. The goal is, again, to recognize dysfunctional thinking. You'll probably see that on the test. And then there is a list here of different techniques that can be used. So cognitive techniques, we can use what's called a downward arrow, which is a logical sequencing of reasoning. So if that were true, what would happen then? We can also go through and label distortions. We can give the patient a list of cognitive distortions and they can kind of identify which ones relate to them. We can look at questioning and automatic thoughts and record a record of their automatic thoughts. They can write it down in like a journal. We can use definite terms like assertive, aggressive, passive. We can focus on unhealthy words and change negative to positive. So for example, people might say like, I'm so anxious about going back to school. We can change it to a more positive word, like you're so excited to go back to school. So another technique in CBT, there's obviously a lot to this because it's used for so many different things. And it is like heavily focused with psychiatric mental health nurse practitioner content. So a cognitive technique, one of them is called Socratic dialogue. So it's a guided discovery where each question is strategically placed in an order to reach a predefined goal. So for example, what was your weight and eating habits like growing up? When did you first notice that you wanted to start losing weight? When you say you want to lose weight, explain to me what it feels like when you want to be 100 pounds. And how does your level of self-worth and anxiety play out with your weight? And so it kind of goes in order of like a history question, a memory question, a translation question, an interpretation question, then an application question. So how can you use what you've learned about nutrition and exercise to encourage physical health in your life? An analysis question. So what evidence do you have to support that conclusion? And an evaluation question. So on a scale of 0 to 10, where would you rate your anxiety or self-worth? And where does it compare to a few months ago? A second example is that labeling cognitive distortions, which we talked about. So we can give the patient a list of cognitive distortions, as we can see our list over there. And they can kind of pick out the ones that they feel like apply to them. And then you can kind of talk about it and reframe it and things like that. So cognitive distortions. This is all or nothing thinking. So they either think like they're a success or a failure. Mind reading. They probably think that I'm incompetent. That might be something that you hear them say. So mind reading, they think something negative about themselves that they think somebody else feels. Emotional reasoning, personalization, global labeling, catastrophizing, should statements, overgeneralizing, control falsalities, comparing, heaven's reward. If I do everything perfectly here, I'll be rewarded later, disqualifying the positive, perfectionism, time tripping, objectifying the subjective, selective, abstract, externalizing self-worth. So yes, there's a lot here, right? So there are some examples. All right, so for behavioral, so that was like the cognitive portion. So the way that we think, right? So it's cognitive behavioral therapy. So the behavioral portion, some examples are things like learning relaxation and meditation or self-monitoring. So providing a detailed picture of how they eat, identifying the exact nature of the eating disorder, help them become aware of what they're doing, and self-monitoring their changed behavior. These are all behavioral techniques. All right, so then we have the next type of individual therapy is psychodynamic psychotherapy. This is originated by Adler. It has data to support the effectiveness with depression, anxiety, bunch of different disorders. And the principles are that problems are caused by internalization of conflicts to powerful desires, wishes, and fears from earlier relationships. Anxiety results and ego defense mechanisms are used to cope with conflicts. The goal is for the client to understand their patterns and relationship conflicts of the past in order to change the behavior and emotions in the present. To do this, they can use techniques such as working backwards, so while assessing current symptoms in light of past experiences, assess past conflicts with significant others, how conflicts were or were not resolved, and how past relates to current situation. And transference is useful and may help to explicate conflicts from the past. catastrophizing, so exaggerating something negative. We can minimizing, disqualifying the positive, should statements, labeling, mind reading, personalization. These are all cognitive distortions that we see. Then we have dialectical behavioral therapy. So this is created by Marcia Linehan, who actually had borderline personality disorder. It is the most effective treatment for borderline personality disorder. So if you see that on the exam, the answer is DBT. It's built on the premise of CBT, but also focuses on emotional regulation, tolerance for distress, self-management skills, interpersonal effectiveness, and mindfulness. And the goals of it are all of those right there. So decrease emotional reactivity, therapy interfering behaviors, self-harm, crisis-generating behaviors, passivity, help with decision-making, and help with communication, emotions, and competencies. Then we have existential therapy. This is by Viktor Frankl, and this understands that patients' subjective experiences, helps them to reflect on life, and self-confrontation is encouraged, emphasizes accepting freedom and making responsible choices, and states that a basic dimension of humans includes finding meaning and purpose in life. So why am I here? So Viktor Frankl wrote the book, A Man's Search for Meaning. And that's kind of relates to this existential therapy. Like, why am I here? What is my purpose? And you might see that on the exam. So definitely know that that is existential therapy. Then there is humanistic therapy. So this is by Carl Rogers. This is person-centered therapy. It assumes people are naturally good. The concept includes self-directed growth and self-actualization. People are born with the capacity to direct themselves towards self-actualization. If you see person-centered therapy or self-directed growth or self-actualization, that's going to be humanistic therapy. Each person has the potential to actualize and find meaning. It builds on CBT technique of Socratic questioning to induce positive emotions, and existential therapy emphasizes on purpose and meaning. To do this, we can use gratitude journals, encourage socialization behaviors, things like loving kindness and meditation, rather than ruminating or dwelling on negative events or consequences. So again, here's just a chart which goes over the goals and principles and techniques that can be used for humanistic therapy. Then we have interpersonal therapy. This was originated by Klerman and Wiseman. It focuses on interpersonal issues that are creating distress. It is time limited, active, and focused on the present interpersonal distress. It was developed to treat an aspect of depression and is effective for adults and adolescents. It has been applied to treat interpersonal distress related to disorders, and the goal is to help people identify and modify their interpersonal problems. And again, nice chart which goes over the guiding principles, goals, and different techniques that can be used for this practice. Then we have eye movement desensitization and reprocessing. This is the EMDR. This is by Shapiro. This is used for post-traumatic stress disorder. So if you see a question on the exam asking about the type of therapy for post-traumatic stress disorder, it is EMDR. It is a form of behavioral and exposure therapy that uses bilateral stimulation, moving the eyes back and forth and alternating between tapping on the hands or knees or sounds in the ears. Goal is to achieve an adaptive response. It has different phases. So the first phase of EMDR is the desensitization phase, where the client visualizes the trauma and verbalizes negative thoughts or maladaptive beliefs and remains attentive to physical sensation. This occurs for a limited amount of time while the client maintains rhythmic eye movements. He or she is then instructed to block out the negative thoughts, to breathe deeply, and then verbalize what he or she is thinking, feeling, or imagining. There's then an installation phase. So the client installs and increases the strength of the positive thought that he or she is declared as a replacement of the original negative thought. And then body scan. So the client visualizes the trauma along with the positive thought and then scans his or her body mentally to identify any tension within. And the end goal, every time your client thinks about their trauma, they should think about the positive thought without it creating tension. All right, so those are all the individual therapies that we have to know. So now on to the group therapy. So the idea of group therapy was created by Irvin Yalom, and the benefit is that it increases insight about oneself, social skills, it's cost effective, and it develops a sense of community. There are 11 therapeutic factors of group psychotherapy according to Yalom. It instills hope. It creates universality, which is they discover that other people have similar problems to them. There's altruism, so the result that sharing with another and helping another. Corrective replication of the primary family group. There's increased development of socializing skills, imitation behaviors, interpersonal learning, group cohesiveness, catharsis. So patients experience catharsis as in openly expressing their feelings, which they had previously suppressed, existential factors, and corrective refocusing. So participants re-experience family conflicts in groups, which allows them to recognize and change their behaviors that could be problematic. There are different phases to group therapy. So pre-group phase is where the leader considers the direction and framework of the group. It focuses on a purpose, goals, membership criteria, membership size, pre-group interview, and informed consent. During the group, there is the forming phase where members are concerned about self-disclosure and being rejected. Goals, expectations, and boundaries are created, and the development of trust and rapport is established. Then there's the storming phase where some members are resistant and may begin to test behaviors. Issues related to inclusion, control, and affection begin to surface. Leaders are allowed to express both the positive and negative feelings, assist the group in understanding the underlying conflict, and examine non-productive behaviors. Then there is the norming phase, which resistance to the group is overcome by the members. There's a strong attraction to the group and others emerge. Open and spontaneous communication occurs. There is the performing stage where the group's work becomes more focused. It's problem solving, solutions, exponential learning, and the focus is on the treatment of goals. And then the adjourning phase is when there is the end of the group and the leaders express their feelings about each other in termination. And also the members express their feelings, and those are the stages of group therapy. There's also reminiscent therapy, characterized by a progressive return of memories of past experiences. Used with older adults, enables participation to search for meanings in their life and strive for a resolution of any past interpersonal or intrapsychic conflict. Structural family therapy, so this is high yield. It is a family systems concept, a type of family therapy that assesses the subsystem boundaries, hierarchies, and coalitions within the family and its structure and focuses on direct interactions between family members. The main treatment goal is to produce a structural change in family organization that's more effective to manage problems. We can use genograms and structural mapping and hierarchy and boundaries. Family system concepts, so the process by which all family members operate together is referred to as the family system. Family system theory is based on the idea that one could not understand any family member without understanding how all family members operate together. The family system operates based on a set of rules that may be overt or covert. Boundaries are barriers that protect and enhance the functional integrity of the family. Types of boundaries are clearly defined boundaries that maintain persons' separateness while emphasizing belongingness. Rigid or inflexible boundaries may lead to distant relationships and to disengagement, and diffuse boundaries blur, and indistinct boundaries lead to enmeshment. There's circular causality, so an ongoing feedback loop, a series of actions and reactions that maintain a problem. Individuals and emotional problems are best understood within the context of the relationship, and though assessed interactions with through assessing interactions with the entire family. There's a family homeostasis, so tendencies of families to resist change and maintain the steady state. Morphogenesis is a family's tendencies to adapt to change when changes are necessary. And morphostasis is a family's tendency to remain stable in the midst of change. Family systems therapies originated from Marie Bowen, believed that a person's problematic behaviors may serve as a function or purpose for the family or to be a symptom of dysfunctional patterns. The focus is on chronic anxiety within families, and treatment goals are to increase the family's awareness of each member's function within the family and to increase levels of self-differentiation. Self-differentiation is the level at which one's self or self-worth is not dependent on external relationships, circumstances. Some other terms to know. So triangles are dyads that form triads to decrease stress. The lower level of family adaptation, the more likely a triangle will develop. A nuclear family emotional system is the level of differentiation of the parents is usually equal to the level of differentiation for the entire family. Multi-generational transmission process is dysfunction present over several generations. Family projection process, so parents transmitting their own level of differentiation on the most susceptible child. Emotional cutoff is attempting to break contact with the family of origin. And sibling position influences interaction and personality characteristics. We know this, birth patterns have different patterns related to personality. It's just an interesting concept. So then there is attachment theory. So attachment is the emotional tone between children and their caregiver, evidenced by the infant's seeking and clinginess to the caregiver, usually the mother. This was created by John Bowlby. The purpose of attachment is to ensure closeness, deal with emotional, environmental, and physical stress, serve as a building block for identity stability, and provide a stable and secure base for future exploration and growth. Predictable attachment behaviors of the infant and child, which is designated to promote survival. Crying, vocalizing, smiling, following the mother, and crying when she leaves. Problematic attachment can be caused by deficient maternal care, a mother who is mentally ill or physically ill, lengthy institutionalization for the child, or mother or primary object of attachment passes away. The attachment disorders are linked to non-organic failure to thrive, separation anxiety, avoidant personality disorder, depressive disorders, delinquency, academic problems, and borderline intelligence. Attachment is the emotional tone between the children and their caregiver, evidenced by an infant's seeking and clinginess to the caregiver, usually the mother. Somebody else who talks about this is Mary Ainsworth. She says there are 3 types of insecure attachment. We have the insecure avoidant. So these happen due to parents being aggressive. The child avoids direct approaches to parents when threatened. Then there is the insecure ambivalent. So this clings to the inconsistent parent and has trouble exploring. And the insecure disorganized is the causes from emotionally absent parents. The child behaves in a bizarre way when threatened. Insecure attachment plays a part in adulthood of how we believe we'll get support when approaching someone or asking for help, or we don't get support. Structural family therapy. This is by Salvatore Munchin, who placed emphasis on how, when, and whom family members relate in order to understand how they change the family structure. A person's symptoms are rooted in the context of family transactional patterns. The symptom is a function of the health of the whole family and maintained by structural problems in the system. The main treatment goal is to produce a structural change in the family's organization to more efficiently manage problems, changing transactional patterns and family structure. So the family structure is an invisible set of functional demands that organizes the way members interact with each other, made up of a subsystem, coalitions, and boundaries. Structural mapping is mapping relationships using symbols to represent over-involvement, conflict, and so forth. And hierarchies are the distribution of power. Then there is experiential therapy, originated by Virginia Satir. Behavior is determined by personal experience and not by external reality. Focus is on being authentic, freedom of choice, human validation, and experiencing the moment. Treatment goals are to develop authentic, nurturing communication and increase self-worth of each family member. Overall goal is growth rather than symptom reduction. It does not focus on particular techniques. Strategic therapy is by Jay Haley. Symptoms are viewed as a metamorphosis and reflective problems in the hierarchical structure. Symptoms are a way to communicate metaphorical within a family. Treatment goals is to help members behave in ways that will not perpetuate the problem behavior. Interventions are problem-focused. Techniques to change include straightforward directives, so tasks that are designed in expectation of the family member's compliance. Paradoxical directives, so a negative task that is assigned when a family members are resistant to change and the member is expected to be non-compliant. And reframing belief systems, problematic behaviors are relabeled to have more positive meaning. So instead of saying jealous, you could say caring. You will need to know for the exam that strategic therapy, that a tool for that is a paradoxical directive, because this really is the only kind of therapy that is using paradoxical directives. So if you see that, strategic therapy. Solution-focused therapy by Deschazer, Hanelon, and Berg. This focus on reworking the present situation. Solutions that have worked previously. The treatment goal is effective resolution of a problem through problem solving, and techniques include miracle questions. So we ask them, if a miracle were to happen tonight and you were asleep and tomorrow morning you awoke and the problem no longer existed, what would be different? So you need to know that for the exam. Solution-focused therapy, miracle question. Exception finding questions, so directing clients to a time in their life when the problem did not exist, and then scaling questions where we can ask them how they would rate themselves related to a feeling. So 0 to 10, how anxious are you or how depressed are you? And again, this is just a summary of the therapy, the principles, the goals, and the techniques. So this is, I love charts. So this is everything we just talked about and maybe a few more, but in chart version, which is so nice. So when we talk about psychoanalytical therapy by Sigmund Freud, these are the key aspects. We know the id, the ego, the superego, and there is this nice picture where we can see that the ego is like in the pre-conscious, conscious area, and the superego and the id is in the unconscious area. And then it goes through some other ones. So psychodynamic therapy, existential therapy, which we talked about, person-centered therapy, humanistic psychology, talks about Maslow's, which you probably remember from nursing school, Gestalt and experiential therapy, behavioral therapies. So just a nice overview. Cognitive therapies, interpersonal therapies, exposure, EMDR, systems therapy, and solution-focused therapy. I really like charts, so this is a nice thing. Then we have complementary and alternative therapies. So these are the holistic therapies that connect, the body and the mind. They're used in addition to traditional medical practices when they're complementary. Alternative is when they're used in place. And integrative therapies is used as a term to describe traditional complementary therapies. So why do we use these? It allows for people to have more control over decision-making. Decreased insurance coverage can always be a challenge. So these, for traditional medical therapies, therefore, sometimes complementary and alternative therapies can be cheaper. Some people have a preference for natural versus synthetic. So here are some mind-body interventions. So meditation, yoga, guided imaging, biofeedback. So this is where a person is provided with a visual or auditory information about the autonomic physiological function of his or her body, so such as blood pressures, muscle tension, brainwave activity. There are uses. We can use them for all of these different things, and obviously the desired outcome is for reduction of those negative symptoms that people are having. There are biological-based therapies such as herbal products, vitamin supplements, and aromatherapy. There are manipulative and body-based therapies like massage, reflexology, acupuncture, acupressure, and stress-related symptoms. Aromatherapy, herbal products and supplements, common supplements that are used and their interactions. So omega-3 fatty acids can be used for ADHD, dyslexia, cognitive impairment, dementia, asthma, lupus, rheumatoid arthritis, but we need to know that it does interfere with warfarin and anticoagulant, has an anticoagulant effect. SAMe is used for depression, osteoarthritis, and liver disease, but it can cause hypomania in some people. It can also cause hyperactive muscle movements and possible serotonin syndrome. Tryptophan, this is used for depression, obesity, insomnia, headaches, and fibromyalgia. Also found in high concentrations in Turkey, but it does have an increased risk for serotonin syndrome, especially if used with SSRIs, MAOIs, or St. John's wort. Vitamin E can help to enhance the immune system and protect the cells. It can be used for neurological disorders, diabetes, and PMS. However, interacts with warfarin and anticoagulants and statins. Melatonin can help for insomnia and jet lag. It does interact with NSAIDs, aspirin, beta blockers, corticosteroids, valerian, cavacava, and alcohol. and can inhibit ovulation when used in large doses. And fish oil is used for bipolar disorder, hypertension, lowering triglycerides, and decreasing blood clotting, but it does interact again with NSAIDs, aspirins, warfarin. Garlic, ginkgo can alter glucose, and most herbal products are contraindicated in pregnancy as they can be secreted in breast milk. Some more herbal products. So black cohosh can be used for premenstrual syndrome, belladonna for anxiety, catnip for sedation, chamomile sedation, anxiety, ginkgo for delirium, dementia, sexual dysfunction caused by SSRIs, ginseng for depression and fatigue, and valerian can offer sedation. So we can also use things like massage, meditation, and reflexology. These are some more complementary and alternative therapies, macrobiotics, and yoga. And that is the end of the non-pharmacological treatments. Hope you guys enjoyed, and I'll see you next time. Okay, bye.